Hi, I'm Elsa Ann Abraham. I'm a speech language pathologist, and in this video, I hope to talk about a few symptoms that a parent or a caretaker can use to help identify if their child has a speech delay or not. What is a speech delay? A speech delay is a small component of communication disorder. Communication consists of language, and language consists of understanding and expressing. So, when a child seems to show a difficulty or a delay understanding language or words, we call that a receptive delay. When the child shows a difficulty expressing language, we call that an expressive delay or a speech delay. Now, according to the University of Michigan Health System, they say about 5 to 10% of the preschool children are affected by a language developmental disorder. So that's a significant amount of children that are showing language delays. And this video will help you understand if your child is hitting the right milestones from the period of birth to 3 years. So between 0 to 3 months, the child should ideally be showing responses to the mother's voice. The child recognizes the mother's voice. The child smiles or responds in some form on hearing the mother's voice. The child might stop crying once they hear the mother's voice because they recognize the caretaker's voice. The child begins cooing, making pleasurable sounds during this period of birth to 3 months. Between 3 to 6 months, the child recognizes tonal differences in voice. So if you are angry, the child understands there is a tone that is different. When you're happy, the child knows that the tone is different in that. And ideally speaking, the child begins imitating back the same tone to the caretaker. Children begin imitating tones and starts producing babbles which are very similar to words. They might try imitating words that the mother or the caretaker is using towards them. Tata, baba, but these are essentially, they need not be meaningful. Between 6 to 1 year, by the time the child hits their first birthday, the child should have used at least one true meaningful word. So that this is the very simple sync that a parent can keep in mind. First birthday, the child should have said at least one meaningful word. For example, like mama or papa, dada, uh, but they are actually calling their parents. So that is meaningful. Between 1 to 2 years, by the time the child hits the second birthday, the child should be using two word combinations like mama give, dada go, things of this sort. By the time the child hits 3 years, the child should be using 2 to 3 word phrases. Mama give food, food yummy. So things of this nature the child will be using. Also, by 3 years of age, the child begins asking questions back, not necessarily in the same grammatical order that adults use language. For example, bye bye, suggesting the child is asking, are we going out? So, there is a tonal difference that the child has already understood and is using back to the adult. So, this is a very rough milestone that a parent can keep in mind when trying to see if your child has a delay or not. Thank you.